So anyway, this is Dr. John. I'm here on July 19th to talk about hypertension. Now, I apologize. There was at least one person who was really looking forward to histamine problems, but I got so many requests for hypertension, high blood pressure. People have been put on blood pressure medications that I really felt I needed to do the hypertension first. So that's what we're going to do today. And it's only reasonable that, in the way that things tend to be reasonable at this point in our lives, that blood pressure would be up. Anxiety is up, clinically diagnosed anxiety, more than 4 times. Depression is up about 4 times. So you would expect then for blood pressure to also have skyrocketed, which it has, along with diabetes, cardiovascular disease, et cetera, because of all the things we're going through. So I'm going to go ahead and do a PowerPoint and share that with you. And there are a couple different things I'm going to talk about today about hypertension. So let me see if I can share here. Let's try that. Okay, so I'm going to start out. There was a nice article that we got from Ron Grisanti. Ron is the president of Functional Medicine University that Catherine and I both graduated from with our certificate in functional medicine. Dr. Grisanti is a very bright guy, and he sends out to us, every few weeks, some really fun information, health information. And so we have taken that one today. A lot of it was in our newsletter that Catherine sent out this morning. And so I want to thank Dr. Grisanti. I've made a few modifications, so his stuff was all correct. If there's anything wrong, blame me. All right. So let's go into it, and we're going to look at how medications affect nutrient levels. Actually, we're going to look at that. We're going to look at what you need to do in order to test or get tested and for nutrient replacement. And then I'm going to talk a little bit about alternative blood pressure treatments. This is a question that I get multiple times a week. There are many things that can be done for blood pressure treatments that people are simply unaware of. And I'm only going to talk about things that are proven. There's a track record for them. So how medications affect nutrient levels. I put a few here, but there are more. The medication can attach itself to a nutrient and then they pass out of the body. It can alter the pH, the acid-base balance in the gut, so the nutrient can't be properly absorbed. And probably the biggest one is some medications need very large amounts of specific nutrients in order for them to be able to work. There are others too, like when we get into some of the diuretics that cause increased urination. Well, in that case, sometimes it's just the increased urination that is washing these nutrients out of the body. So we'll talk a little bit about each of those and what you can do about it. So these are a few of the major categories of blood pressure medications. And I'm talking about then the nutrients that are commonly depleted and what the result is of those nutrient deficiencies, because they can be extremely significant. And unfortunately, I've been doing this for a long time. I've seen a lot of people, and it is very rare that I have ever had a patient come in and said, I'm having these problems and I don't know what's causing them. And my doctor said it could be because of this drug. I hear that almost never, unfortunately. And every drug, I don't care what it is, has some side effects. And they're not really even side effects. They're known effects on many of them. And then there are side effects that in terms of, for example, the nutrients. So it's one of the things you want to look at or have someone else look at for you whenever you start to get new symptoms, because they can be directly caused by the pharmaceuticals that you're already taking. Okay. Now we know that, but we tend not to think of it at the time. So talk first about ACE inhibitors. These are angiotensin converting enzyme inhibitors. And so they stop the action of angiotensin, which please, you don't need to know, but it causes constriction of the blood vessels and increases blood pressures. Now, these are one of the really commonly used families. Most people that are on one or more of these drugs, the blood pressure drugs, will be on an ACE inhibitor. The one I see the most is lisinopril. It's, a huge percentage of my patients is on lisinopril, has a pretty good track record, not a lot of severe side effects. Coughing is the most common one, but they all do have side effects. And this category of drugs, you can tell because they end in PRIL, the angiotensin converting enzymes, lisinopril, enalapril, ramipril, and some of the nutrients that can be depleted. And this is not a totally comprehensive list. I'm just hitting the high points. So we're looking at zinc, magnesium, potassium, and calcium as the primary things that can be depleted. Now, many of you will recognize the fact that you can't live without potassium or magnesium or calcium, and you'd be very sick without much zinc. So this is really critical. So potential nutrient problems of being deficient in those electrolytes and minerals that I had on the last page: hair loss, slow wound healing, we know that from zinc, taste and smell problems we see with zinc, prostate problems we see with zinc, etc. Loss of sex drive, frequent infections, leg cramps. The first three things that I give people for leg cramps are potassium, magnesium, sodium, and sometimes calcium. So those are huge. Weight gain, bone loss for sure, high blood pressure. Now, how ironic is that? One of the side effects of this blood pressure drug is it can cause high blood pressure. So why you want your doctor to really be paying attention as you're going through this, and why you want to monitor your own blood pressure very regularly. I mean, you don't have to get fanatical about it, but a few times a week. When you do monitor your blood pressure, get in the habit of taking it a few different times of day. So one day, take it first thing in the morning. The same day, maybe take it midday or early evening after work, for example. But alternate the times that you take it, because the timing of the high blood pressure or of the blood pressure can tell us a tremendous amount about what the source of the issue is. And of course, these do have a little bit higher risk for cancer. So what do you do? Well, you should do, if you're taking this category of drugs, usually it's going to be lisinopril, do frequent metabolic panels. So that's a chemistry panel. We run what's called a Chem 14, but what you just need a metabolic or a chemistry panel. They use those interchangeably. These are very inexpensive. If we run it, it's under $20. They're moderately accurate. Any of the tests for minerals in the blood are less than perfectly accurate because so little of those minerals are actually in the serum, in the fluid part of the blood. So there are tests that are better. There's a red blood cell analysis. We use that when we have strong suspicions of copper or zinc issues in particular, or magnesium, because red blood cell levels of those are much more accurate. Excuse me, that's a little bit more expensive. Those are running about $60 a piece. So to do a whole panel, it's going to be around $300. Or you can do my new favorite, which is OligoScan. And that is a device that shines light into the palm of your hand, and it penetrates about 4 millimeters. And it is then able to check the level of a variety of things in your blood, including minerals and toxic heavy metals, which is what I like it for, because the toxic heavy metal tests are generally not very good. There are hair tests, and that's just what's being excreted. There are urine tests. That's only accurate if you use some type of agent to release it from the tissues, or if it's a very recent exposure. So none of them are perfect. So and the OligoScan isn't perfect either, but it's relatively inexpensive. around $100, and it can check for a bunch of things, even vitamin levels. So what do you do if they're low? First thing would be take an electrolyte supplement. Now check with your healthcare provider first on that one. There may be a reason they don't want you on an electrolyte supplement. Those meds, the blood pressure meds and other meds, can cause a retention of too much of the electrolyte, which can cause problems also, like too much potassium can cause heart arrhythmias, amongst other things. And so if you're going to do an electrolyte supplement, check with your healthcare provider before you take it. But they are generally quite safe. And what I didn't put here, since zinc is one of the things, would be to do a moderate level of zinc supplement. And there are lots of good reasons, as most of you know, for taking zinc at this time in 2022. Okay, so let's take another look here. Now we got calcium channel blockers. This is another pretty commonly used grouping. Not quite as, I don't see it quite as commonly used as the ACE inhibitors. That's not quite true. I see a lot of amlodipine. Actually, that brings another point that I might forget later. I'm seeing a lot of studies over the last couple years, and I'm seeing doctors changing their prescription habits around blood pressure meds in a way that I think is very good. Traditionally, a doctor would give a blood pressure medication, hydrochlorothiazide, for example, a diuretic. And if that didn't work or there were side effects, then they'd give something else. That didn't work, they give something else. Well, now most doctors that I see are actually giving 3 or 4 of these different types, one from each from different families of these hypertensive medications, and they can do it then at much lower doses. So you might do a quarter of a dose of 4 different medications rather than 4 times the dose of one. And that's going to have a lot fewer side effects. So I think it's a much better prescribing practice that we're now seeing. And so things that can get really depleted here, potassium and calcium again, but also vitamin D, and probably, I put possibly, but probably coenzyme Q10. Symptoms that can occur here, again, you get the fatigue and the leg cramps. You can get other cramps too. I know people that get guitar players that get hand cramps, frequent infections, thirst, all of this good stuff, and high blood pressure. So here we go again, a high blood pressure medication that can cause high blood pressure, okay? So, and amlodipine I've seen cause irregular heartbeat. So it's one to watch for if you start getting a rapid heartbeat in particular. So what do you do? Pretty much the same thing as the last slide on what to do. You do frequent metabolic panels and vitamin D and CoQ10 tests a little less often. They're a little more expensive. Generally, if vitamin D is in a good level, you don't have to check it very often. These are moderately expensive. I put less than $20. That is no longer true. I should have changed that slide. Here you're looking at closer to $100. Moderately accurate again, and then do an annual more in-depth check, and that's again the red blood cell levels and or an oligo scan. And what do? You take an electrolyte supplement, again, check with your healthcare provider first, take vitamin D or get sun. There are very, very few people who cannot safely take vitamin D. There are some, and there are signs and symptoms to look for. So some people will get what they think is a sun rash. That can actually be a more significant problem from taking vitamin D and being in the sun. And anybody with autoimmune problems or very high levels of inflammation, I will do a second vitamin D test. One is the storage form and one is the active form. If you have tons of the storage form, it's fine. It doesn't damage anything because it's almost inert. But if you have too much of the active form, that's very heating, cause a lot of inflammation and some kidney damage. So if you have autoimmune disease and you show up with low vitamin D, or you've got just raging inflammation and you're low in vitamin D, don't just pop vitamin D. You need to get both of those tests done, and you need to have them done at the same time to see if you're over-converting. I had a couple patients with severe kidney problems a few years ago, and they had incredibly low vitamin D levels. Their doctor told them to take these huge levels of vitamin D, and fortunately, I got them in time and did the other test and found that they were 4 times a safe level of vitamin D, because when there's a lot of inflammation, a lot of cytokines, they block the vitamin D receptors, and so the body keeps converting more and more of the inactive vitamin D to active vitamin D, but you can't use it because the sites are blocked. So it's a little tricky. And then take CoQ10. You're totally safe. Beta blockers, example of beta blockers are atenolol, metoprolol. Those are the two that I see the most. Bisoprolol, I see quite a bit of too, but metoprolol is also a rhythmic agent. So I see quite a bit of metoprolol, and atenolol is a very, very old drug, and I like very, very old drugs. Excuse me, because they've been around long enough that we have a pretty good idea what the side effects are. Now, these block adrenaline uptake. So particularly when people first start on them, it's hard to even function. I mean, you're kind of walking down, bumping into the walls, you're dizzy, just grossly fatigued. People tend to kind of grow into them so they don't cause as much of a problem. Different people are more or less sensitive to them. But again, they're blocking adrenaline uptake. So people that are very stressed, or those of you that get white coat hypertension, right? Those would be clues that you might need a beta blocker to block the excess adrenaline so that it doesn't cause hypertension. Now, these can deplete the body of coenzyme Q10 and melatonin. So this is really severe in terms of potential problems. So you can have insomnia, obviously from the low melatonin, disrupted sleep, increased risk of cancer. Cancer risk goes up significantly with low melatonin, autoimmune disorders, muscle cramps, and memory loss. So basically, you're going to take melatonin and CoQ10 on those, right? Again, melatonin, almost anybody is fine with melatonin. About 10% of people will have wild, wild dreams, and about 10% feel a little dopey in the morning. But otherwise, melatonin is magical, as is CoQ10. Okay, a couple of centrally acting medications. We got clonidine and methyl-dopa, and both of those can deplete CoQ10. And CoQ10 is called ubiquinone or ubiquinol, depending on the form it's in. And it is called ubiquinone because it's ubiquitous, means it's in every cell of the body. It's needed by every cell of the body. When people have problems with statin drugs, it's mostly from the low CoQ10, as well as sometimes they get the cholesterol too low. But the CoQ10 is a big problem. So again, all of these things, right? Fatigue, weakness, muscle and leg cramps. And you see, the reason for this is CoQ10 is needed to produce energy. And you have to have enough energy to mount an immune response to protect you against infection, to protect against memory loss, so that your muscles aren't weak, so that your heart is pumping strong enough that it's doing the job. So I don't see these used very often as blood pressure medications, fortunately, because they're not my favorites. So take a CoQ10 supplement, right? It's really important in energy production for every cell of the bodies. Now, the variety of possibilities, there are a variety of possibilities because there are different types of ubiquinone, and they will work in the body a little bit differently. But the bottom line is ubiquinol has 2 times greater bioavailability. Now, depending on the quality of the company, the quality of the product you're taking, it could be anywhere from 100 milligrams to 300 milligrams a day, or even more in people with heart problems. So this is when you definitely want to check in with your healthcare provider and make sure you're getting really high quality and you're getting the right amount. Okay. So then diuretics. So we have tons of diuretics. We have aldactone or spironolactone, which is a potassium-sparing diuretic, and then we have hydrochlorothiazide, which is the most commonly used of these. So in general, they cause increased urination, which lowers the volume of fluid in the blood, okay? So you pee out the water doesn't build up, there's less pressure on your heart, there's less pressure on the blood vessels, and it's just easier to pump the blood throughout the body. Now, hydrochlorothiazide was a first-line hypertensive medication, often used alone historically. But because of the side effects, I see it used a little less often and frequently at much lower doses than I saw it used at many years ago. Now, there's a danger of dehydration. You're peeing a lot, and you can get excess sodium loss because you're peeing a lot. And both of these can lead to being lightheaded or having orthostatic hypotension. So this is a big deal. I did a show on, a lot of the show was on orthostatic hypotension, which is low blood pressure when you stand up. And this is a real problem for older people that are on blood pressure medications. They get out of bed, they stand up to go to the bathroom at night. Their balance probably isn't perfect in the first place, but they also then will lose consciousness because not enough blood flow getting up into their brain because they don't have enough blood volume. And then they can fall, hit their head, fall and break a hip, etc. So it's a real problem. So if you have relatives or older people on diuretics, make sure that they're getting their sodium levels checked and that they're not getting orthostatic hypotension. Also, you can get potassium loss from the urination, which is also problematic. So then you've got a category of diuretics that are called potassium sparing. So because it's been recognized that a lot of people pee out way too much potassium, which will cause cramping and heart problems, etc., they've used this category of potassium sparing. Now, that's good that you spare the potassium, but if your biochemistry is off in other ways, you can get a very high potassium to sodium level, which is bad. Okay, so you got to really get this one right. So spironolactone blocks testosterone receptors. It's often used with hormonal issues, but it also disrupts ovulation, estrogen metabolism, and adrenal function. Has a big effect on adrenal function. You can get loss of libido, menstrual problems, breast pain. It has been linked to breast cysts and possibly breast cancer. So not one of my favorites. I think there are other ways that this can, be looked at. For one, you can give potassium to patients that are having a loss of potassium, but where everything else is working. So anyway, this is one you want to get checked out regularly if you're on it. And these have a very strong effect on all electrolytes and a lot of vitamins and minerals in the blood. So remember the B vitamins, right? B1 through 17 or however many you want to look at are water soluble. So that makes them very susceptible to diuretics washing out too much of the B vitamin. Now with fat soluble vitamins, you don't really have to worry about that. But here we see the same characters: calcium, magnesium, potassium, sodium, all critical. Those have to be in very tight ranges. Zinc, vitamin B1 is more susceptible than most of the B vitamins to being washed out. And B1 is critical to prevent neuropathy and other disorders. And this is a particular issue for people on diuretics that are drinking significant amounts of alcohol, because the alcohol also depletes B1 and folate. Okay, what do you do? So once again, get frequent metabolic panels and also CBC. That's a complete blood count. Again, this is inexpensive, less than $25, pretty accurate. And then do more for in-depth checks, red blood cell levels again, or an oligo scan. What do you do if you're low? Take an electrolyte supplement, take a B vitamin with thiamine and methylfolate. Okay, and again, those are essentially, you can't overdose on those. They're both water soluble. They just wash out of your system if you take too much of it. So this is a real simple one. Okay, now I want to look at some other possibilities and how to lower blood pressure. One that I rarely hear this one offered up as a suggestion, but it's a really good suggestion, which is to donate blood. Thicker blood is harder to pump, right? If there's more volume, it's just putting more stress on the heart. The heart has to beat harder. It has to really change the tightness of the blood vessels. And so you get hypertension. So on the CBC, that's a complete blood count, look for a high hematocrit. Hematocrit is how tightly packed the blood is with solid elements. If it's too tightly packed, it'll be thicker and harder to pump. Look for high MCV, that's mean corpuscular volume, and that indicates the average size of the red blood cells. If they're too big, it causes crowding. Here's a caveat. If you go to most labs, they'll have a range of either 80 to 100 or 79 to 97. Both are wrong. You do not want your MCV to be higher than 90, maybe 91, because those are indications that you probably have folate and B12 deficiency or B12 deficiency, and that your blood's too thick. High hemoglobin. Now, we all want to have lots of hemoglobin because that gives us more oxygen carrying capacity, but studies have shown that there's significant increased cardiovascular risk with elevated hemoglobin. And one of the real biggies to look for here that is rarely called out by medical doctors, and that's a high platelet count. So the so-called standard reference range for most labs is under 450. Some labs it's under 400. But I promise you, I've got great research showing that there's significantly increased cardiovascular risk over 280. And I've had several women come in that had recurrent miscarriages. Someone looked at their labs and said, oh, these are all great, you're just fine. And they had platelets in around the 400 range. Well, platelets are blood clotting mechanisms or cells, and you don't want to have high blood clotting range or high blood clotting potential when you're pregnant, right? You need to get blood to the placenta. So these are just some things you look for in your CBC, and then go out and help somebody. Donate some blood, help you, help them. It's all good. Ah, yes, here we are. It's the one that everybody hates to talk about. You relax. When you physically relax, the messages that are being sent to your entire cardiovascular system change. Your adrenaline level in particular will go down when you start to relax, and epinephrine or adrenaline is what causes the blood pressure to rise in order to meet the emergency that the body thinks is happening. So you get a restriction of the blood vessels, the blood pressure goes up, and it's very, very dangerous. By the way, the worst day of the year for heart attacks is the Monday after we change the clocks. I can never remember which one's which, but where you lose an hour of sleep for daylight savings times. That Monday is the #1 day for heart attacks. The worst day of the week is Mondays. People will kind of relax over the weekend. They, maybe eat too much, drink too much, and then on Monday morning, they want to sleep in. They get up too late. They're in a hurry. They're rushing around, and bam, really a problem. So anyway, anything that's meditative or relaxes you. Now, for some people, yoga does not relax them. They think it's a competitive sport, and they just get crazed trying to do yoga and doing postures. For them, it's probably not very helpful for their blood pressure. Tai Chi, I love because it's the best exercise to keep strong bones. It's the best exercise to prevent falling or fear of falling. So really consider taking a Tai Chi class. Yoga's great too, does a lot of fabulous stuff. Hobbies. And again, I put hobbies and nothing specific because it's whatever relaxes you. Some people get relaxed reading a book. Other people, their blood pressure goes up. Some people get relaxed doing gardening. Gardening will put my blood pressure right out the top of my head. I don't like gardening, right? It's just an annoying thing to do. So it's not good for me. But for most people, watching comedies versus stressful or frightening movies is one of the best things you can do in your life. Walking, several studies showing that walking barefoot on cobblestone would reduce blood pressure by over 10 points, and some were up to 30 points for 24 hours. Now, even if you can't find cobblestones, which are not so easy to find here in the US, walk barefoot if it's safe on the beach, on some grass, whatever you can find to get some texture on the bottom of your feet. They actually make floor mats like kitchen mats and other mats that have cobblestones built into them. So you can stand barefooted while you're washing your dishes and get your blood pressure down. So that's kind of cool. And then there's grounding. So in grounding, I'm not talking about the grounding mats. There's a lot of disagreement about those. But getting your feet barefooted on the grass, on even brick or even cement, you're going to get some benefits, will lower your blood pressure. And this is also great for sleep if you ground out before bedtime. So that's a couple easy things. Third, respirate. Good clinical evidence. We have one in our clinic. It's basically a biofeedback device. You put that belt around your chest, you put the little ear things in your ears, and you turn it on, and it will signal you when your breathing is out of balance, and it'll signal you when your breathing is in balance. And this has a really, really good track record. We use one in our clinic. Hand grip exercises. Now this goes back, this article was from 2004 in WebMD, but there are articles that go back well before that, that hand grip exercises are very good at lowering blood pressure. So either isometric, where you're just squeezing it, or isotonic, where you're actually pumping it, both will lower blood pressure. 1 hour a week of hand grip exercise reduce systolic pressure by more than 10 points. So if you watch TV, there you go, 10 minutes a day, 10 minutes a day while you're sitting there watching TV, watching your comedy, and you can get your pressure down by 10 points. Now, the point of this is, now you may have pressure that has to go down 30 points. Do everything, right? Do everything I'm talking about here. They're all in the realm of, reasonable periods of time, and they are additive with each other. Also, even if you needed then to still do some medication, you could probably reduce your medication by half or more, which is going to cause fewer nutrient deficiencies and fewer side effects. And this one is kind of interesting. This is a company, GEHA, but I just wanted their quote here. I had known this. I read the original article on this, which was pretty mind-blowing. And, the pilots who are flying these F-16s are so fast, and the G forces, the gravity forces, are so strong that they have to wear pressure suits. And even with that, a lot of them were starting to pass out. And so they started having them grip the steering wheel very, very tightly and pump it even like they're doing hand grips in order to keep them from passing out from the G forces. And what they found through time is that the pilots' blood pressure would go up over 200, their systolic, but that in general, they had the lowest blood pressure of the people being tested, because that combination of the hand gripping actually caused a long-term low blood pressure. So this is pretty cheap. I mean, those things are what, 10 bucks? Okay. Lower inflammation. Inflammation causes thicker blood. Inflammation damages the blood vessels. Inflammation increases blood sugars. It's the key cause of obesity. All of those are increasing blood pressure. And inflammation is also the primary cause of all of our leading causes of death in the US: cardiovascular disease, heart attack, stroke, cancer, et cetera, et cetera. And the primary starting point of inflammation is in the gut. There are now thousands of reports and hundreds of well-done studies showing that inflammation really starts in the gut. So if you've got high blood pressure, work on your gut, as well as some of these other techniques to get it down. In our clinic, we use red light and we use infrared light frequencies because they lower inflammation. If you lower inflammation, your blood flows better and you have lower blood pressure. Using sunlight reduces inflammation, so sitting in the sun for a few minutes. But the red light and the infrared light won't cause sunburn, and we get great results. Now, this is a pretty strong looking guy, and that's probably not a coincidence. Many of the professional sports teams, particularly football teams, use red light and infrared light to lower inflammation, and they'll have their players sit in front of them on pretty much a daily basis. My favorite is PEMF, that's pulsed electromagnetic frequencies. These cause the arteries to pump more efficiently. It thins the blood, it keeps it from coagulating, which is one of the primary causes of high blood pressure, is hypercoagulation, where the blood's very thick. And so this is going to increase blood flow to lower inflammation and lower blood pressure. So we have 4 different kinds of biomats and PEMF units in our clinic. We use them all day long, every day. We love them, and my patients love them. Okay, and then there are tons of herbs and supplements for hypertension. But just like with the medications, the key is you have to know what the root is. So is the cause having too much inflammation? Is it too much stress? Is it fluid retention? And so then you come up with an herbal formula that can treat that. And so this is just one example. This is poor circulation with fluid retention, which is very common. And these are just a few of the herbs that help with sodium and water retention. Okay, and a lot of these, dandelion, ginger, parsley, hawthorn, juniper, you can get and make tea out of and sip it all day. And then there are Chinese herbal formulas like Wuling San, which is directly diuretic. And a lot of my patients are able to get off diuretics and use Wuling San. So again, I'm not going to go into a whole tract about specific herbs and supplements, but just keep in mind that they have a role. And so if you're doing PEMF, red light, respirate, grounding out, you're going to feel great. And your blood pressure is probably going to come down into a very, very normal range, and you won't have any of these side effects that I was speaking about at the beginning of the presentation today. So you've been tuned in to Ask Dr. Nieters. That's a picture of me when I was a little younger. Had my hair a little shorter, I guess. And these are, tell your friends, send us questions, and have them join us on Tuesday afternoons. And I'm here to answer questions. Any questions? Do I have a recommendation for a PEMF unit? Yeah. I'm actually a distributor for Beamer. I've never sold a Beamer. I got it because I wanted to use it to buy one. They are the best proven. They've been used in Europe for decades and are approved there for hospital use even, because they're so powerful at increasing blood flow. I find them, at least in my income realm, to be very, very expensive. We're looking at about $4,000 to $5,000 out the door. So I have used a mat that I find works really, really well. And it's a combination. So I don't know if you remember back a few slides, there was a picture of a woman that was lying on a mat. That was called a healthy wave mat, a healthy wave mat. And that had built into it the PEMF, the red light, the infrared light, a biomat where there's far infrared that's shining through amethyst crystal, and a negative ion generator. And how much was the one in that picture, Catherine?
That was about 1,500 to 1,800.
So that was, yeah, so under $2,000. It did 5 things, and we love it. My patients love it. I personally have a small one that I put on my chair as a mat, and it does the same things, but it's much, much smaller and it's flexible. And that was how much?
500.
500. So if you're interested, contact Catherine, and she can set you up with the different types of options and see where you want to go. Okay, well, this is Dr. John. I've enjoyed being here. Keep those slides because you may want them if you ever go on blood pressure medications to kind of prevent any of the side effects. And if you have questions, send them to us, email them. You can call in during the show, or not call in, but chat while we're here on the show. And we would love to hear from you. Okay.
Another question.
Another question.
You mentioned donating blood. Is there any age restrictions on this?
You can't be too young, but I don't know what the age is. I don't know of any age restrictions because you're older. And the other cool thing is they'll test your blood and they'll tell you if you have any problems you need to look for. And so it's a freebie, right?
That is nice.
Totally cool. All right. Thank you. Happy Tuesday. And we'll be back next week. Bye-bye.